We are now live with Dr. Köhrmann, urological surgeon at German Medical Center. We are going to be discussing early detection, diagnosis and management of genitourinary malignancy. Doctor consults at the Dubai Healthcare City, Ibn Sina Building 27, Block B, Clinic 302. Thank you so much for being with the Gulf today, Doctor.
Thank you for the opportunity to talk with you about these questions.
Yes, we have a lot of questions to be asking you. We would start by asking you, how common is kidney stone among people?
Yes, kidney stone, especially here in this region in Arabia, are very common, and a lot of people having stones, and if they have, if the stone is removed, the stone can come again, and so on. Therefore, it's very common.
Okay, it's very common. All right. What are the reasons which we can point out for having kidney stones, doctor?
Yeah. The problem is that the drinking is a very important point for to protect you for upcoming stones. And you should check your kidneys by ultrasound if you have kidney stones, if there's any pain in the flank, so on. And the urologist can check up if it's necessary to treat the stones just before they make problems. Flank pain, fever, or destructing the tissue.
All right. Is even the consumption of water a problem for developing kidney stones?
Yes. You can reduce the risk for kidney stones if you drink a lot. The amount of water you should drink depends not on a fixed sum of liters, but you should look that the urine is light, that it's yellow light. And if you would like to measure the amount, you should avoid around 2 liters a day.
Okay, 2 liters is normal. Okay, what are the side effects of a urological surgery, doctor?
That depends on the procedure. Nowadays, you can have minimal invasive procedures to remove a stone. And therefore the risk of side effects is very low. You can have shockwave lithotripsy to destroy the stone within the body, and the small particles are passing spontaneously. There's a low risk of a little bit bleeding in the urine, but that is not of high danger for you. And on the other side, there are the possibility for endoscopic procedure. You're going in with an instrument to the bladder and to the ureter, destroy the stone by laser. And since these instruments today are very small, very thin and flexible, the risk for your organs are also very small.
Okay, so there are a couple of myths that we'd like to discuss about. Will one urological problem lead to another? If one urology problem, does it lead to another problem, or is it just like one and you don't get, like, does kidney stone develop into some other problem? No.
Yes, you can, if you have kidney stones, that can damage the kidney and cause an infection, to make bleeding, pain, and so on. And therefore, stones are of risk even for other organs.
All right, doctor. Can you discuss with us details of a normal urology surgery? What are the procedures that the patient needs to go through before and after?
For the kidney stone?
Yeah.
For the kidney stones, usually you can apply the so-called shockwave lithotripsy, the extracorporeal shockwave lithotripsy. For that, you have a shockwave source, so that's the bag you put to the flank to the patient, and you see the stone by X-ray or by ultrasound, and you apply small shocks to the stone and destroy the stone and then the fragments are passing spontaneously. That is very common for kidney stones. For ureter stones, that's different. For that, you are using endoscopes going via the urethra to the bladder and to the ureter endoscopically, and you go in within the body. These are two different procedures.
All right. There is a viewer who's asking us, her name is Hiba Jamil. She wants to know how much water do we need to drink?
Yeah. The amount of water you have to drink depends on your weight, on your activities. If you're physical active and you're fit and you lose a lot of water, not by the urine, then you have to increase your water intake the day. And therefore, the best is to look to the urine. If it's light yellow, then you drink enough. That can be for a young lady with around 60 kilograms. That's could be 1.5 liter to 2 liters, and for a man with 100 kilograms, that should be more than 3 to 4 liters of water. That depends on the person and your activities.
All right, doctor. Is the prostate the reason when you have to go to, when one has to go to the toilet very often?
Yeah, that's also a very common problem, that man feels that he have to go to toilet very often, frequently. In the night, 3 to 4 times. That is not very nice, and you cannot sleep enough. In the day, you have to go to toilet very frequently, and you have to interrupt your activities. That's not nice. And you will ask you if it's my prostate, which is not okay. But we have to say is not definitively the prostate. There are a couple of other reasons. That can be the problem of prostate, definitively, but also of the bladder, and there can be an infection that can be cured very easily, but also can be influenced by other general diseases like diabetes or so on. Therefore, we have to check up as a urologist exactly what is the reason, and then decide if it's necessary to treat the prostate by medication or treat the other reasons.
All right. Leila Mansoor wants to know how many times normally do we need to go to the washroom, the toilet?
In the night, that should not more than 2 times. Usually for younger people it's 0, but up to 2 times, that's tolerable. If it's on the day, usually the interval should be up to 4 hours, depending on that what you are drinking. But if you have to go to toilet the whole day, every 2 hours, that's too much, and we should check it.
All right. So Leila also asks if the infection can transfer between the spouses.
Usually not. The infection of in the bladder is different to sexual transmitted disease. These are completely different bacteria. For the cystitis, and even for the man, if he had a bladder infection, that is usually not transmitted. The urethritis, infection of the urethra by the so-called sexual transmitted diseases, that can be transmitted, but not this normal cystitis.
All right. Is it meaningful to check the prostate for cancer regularly?
Yeah. As a urologist, I have to agree that sometimes the check of the prostate is not sensible for the very young people and for the very old. people that is not so necessary. But for the starting from an age from 40 to 45, you should check the prostate by physical examination, by palpating the prostate using the ultrasound, and additionally by the so-called PSA level. That's a blood value that should be looked for, and you can judge from that about the risk for prostate cancer. And if you find out prostate cancer very early, you can treat it so that if you are in the very early stage, you do not have to take out surgically the prostate. You can treat the cancer within the prostate.
All right. Usually among men, prostate cancer is diagnosed late. How does someone detect it early?
To detect it early, but the best to check the prostate, as I said, especially also by PSA, by palpation and by ultrasound, and to do that regularly, starting early with the age of 40 to 45, and do it each year, and then you can see if the PSA level is increasing or is stable, and from that you will judge to decide to look for cancer. Nowadays you have a good possibility to diagnose prostate cancer very early by the multiparametric MRI. The magnetic resonance imaging is now very precisely, very specific to find out, is there cancer with a probability of that, and if there's some area suspicious, then where it is. And when you now have to take a biopsy to prove the cancer, then you know very exactly where to take the biopsy, and that is since a couple of years possible, and therefore our specificity in detecting the prostate cancer is improved definitively.
Okay. Zaibi Jahan says that he's a patient of DVT. He says that he's a patient of DVT and he has blood clotting in the lower lumbus. So he wants you to suggest some way that you could help him.
The TVT is for no, sorry, I do not know. Okay. The TVT is for incontinence. And what's the problem now for this lady?
Oh, they just have mentioned that they have blood clotting in the lower lumbus.
Okay, that should be investigated by cystoscopy, since could happen that the TVT is damaging the urethra, and therefore you should check that by urine analysis to rule out the infection, and otherwise to rule out any other diseases of the bladder. Blood clotting should be checked definitively soon.
Okay, what is the risk of recurrence after surgery or any kind of radiation for this kind of trouble?
For the prostate cancer?
Yeah.
Prostate cancer is routinely be treated by radical prostatectomy. The highest risk or side effect of this procedure is the incontinence and the impotence. And with the new techniques of surgery, you can avoid this in a lot of cases, and therefore you should not restrict or to fear these side effects. Is the risk is not so high in nowadays for the side effects. The risk for side effects for radiation is that you have irradiation also for the bowel, and therefore bleeding, or frequent stool, for higher stool frequency to empty the bowel, that is the risk for that. And the risk will increase with the time, or can increase with the time, that you have side effects after radiation, after 5 to 10 years starting on, compared to the surgical procedure. Yet then you have in earlier times the side effects, which heals out later on.
Okay, so Khalil Majdalawi is asking if there are any special offers for a full checkup.
Yes, a full checkup for urological organs is usually done by the urologist to look for the kidney, for the prostate, for the testes, and bladder function. That can all be done in the office routinely, with looking to the uroflow. The same is for the woman, where we check if the voiding of the bladder is okay, no incontinence, and to check that in the office.
Okay, all right. So Alia Hassan is asking how we can differentiate between the symptoms.
The symptoms for bladder, for with the voiding of the bladder. Sorry? Which symptoms we have to differentiate?
They haven't mentioned what symptoms, but I'm assuming it's about the bladder.
Yeah. Okay. First, I talked with a patient and can find out what is also necessary to write down the amount of urine you are avoiding, and then I am using ultrasound to look if the bladder is empty, and to look to the urine analysis, to the other organs like prostate, kidney, and so on. And finally, it could be necessary to do a cystoscopy to look inside the urethra in the bladder, but that is not the situation for all cases.
All right, so for everyone who's asking where doctor consults, he consults at the Dubai Healthcare City. And yeah, so doctor, would you like to tell us how important and how often should one visit the urologist?
Yeah, routinely, if there are no complaints, the routine checkup each year is sufficient. If we find out something special should be checked in an earlier time, then we arrange a checkup, and we will see what that is done on demand.
Okay, all right. So are there any options for treatment for erectile dysfunction?
Yeah. Erectile dysfunction is a very common and a problem. Usually it's coming up by age, and but also very young men are suffering from erectile dysfunction in special situations or generally. And we can usually check what's the problem. The hormones can be the problem, some psychological aspects, and diseases like diabetes, hypertension, and medication can influence the erectile function, and these are all should be checked up, and then usually we are applying medication. But nowadays, if that is not sufficient enough, we can also apply, for example, shock waves to the penis to regenerate the tissue in the penis and to improve the blood perfusion. On the other side, there are some men who have an increased outflow of the blood from the penis, and then the erection is not so good, and that can be also treated by occluding these veins and to improve the potency.
Okay, so Zaibi Jahan says that he's a boy and he is asking for a suggestion for checkup for DVT because he has already checked in Pakistan, but the doctor has asked him to have Xarelto tablet, but the problem is still persistent.
It's a boy?
Yeah.
And he had recommended TVT?
DVT, yeah.
TVT, the TVT is usually for women with stress incontinence, and therefore I cannot see what should help the TVT for the boy.
All right. So, okay. So, what are the common symptoms that people overlook, which we could actually help in the detections? Like most times, we just overlook unusual behavior. So, can you tell us the common symptoms that we should not be overlooking?
Yes, especially pain and blood in the urine, that shouldn't be overlooked. Especially when there's blood in the urine, you should check that for if it's not dangerous cystitis, an infection, or is it a bladder tumor. On the other side, if the stream of the urine is very bad, then it could happen that you have a urinary retention, and that should be also checked.
All right. So, what is the kind of diet a person should have to avoid such things? How much of consumption of the right food do we need to have?
Especially for which disease?
In general.
Okay. To reduce drinking, we talked already about that, is necessary, and to eat not too much meat. That is a recommendation which should be given, and to have a adequate weight, not to reduce the income of calories. That's the best way. Yes, to protect from urological diseases. In generally, that depends a little bit on that what you would like to be protected from. Yeah.
Okay. So, what are the general lifestyle changes one brings after being diagnosed with prostate cancer? What are the differences that one brings in their lifestyle after being diagnosed?
Okay. After the diagnosis of prostate cancer, that is that depends on the procedure you are treated by, and if you have an early stage of a tumor, that can be cured, and you have to be followed up by after the treatment very precisely, not to have a recurrence of the tumor, and the influence on continence, on sexuality, is mainly influencing your life thereafter. If you have an advanced tumor, usually in the later age, then you could get pain in the bone due to metastasis, and that can influence also your life dramatically, and the life expectancy can be reduced.
Oh, all right. So, do herbal medications help with any urological problems in general?
In general?
Herbal medication.
Oh, but yes, there are a couple of medication, herbal medication that can support your body to cure the diseases, and therefore I recommend that very frequently. And yes, in the different diseases, for kidney stones, for prostatic disease, even for erectile dysfunction or incontinence, we can use herbal extracts to improve that.
Okay. What are urodynamic studies, and when do we need them?
Mm-hmm. Urodynamic studies mean that we put in a catheter in the bladder that fills the bladder, and we measure the pressure in the bladder during filling and during voiding the bladder, and that can tell us in voiding disorders is the reason for that for the voiding disorders the bladder or the prostate, or for women is it prolapse, or is the reason of a problem in the nerves stimulating the bladder, and that is very helpful diagnostic procedure to find out what's the problem in voiding disorder.
Okay, how are urological problems different from, how do they differ from in men and in women?
For the bladder?
Yeah.
For bladder, yes, that's the main problem in man is that you cannot void enough. The stream is obstructed by the prostate, and that is different from women. Women experience usually incontinence since the sphincter mechanism is not sufficient anymore, and that can be induced by the prolapse, or that the bladder and the sphincter is coming down in the pelvis, and therefore the function cannot be so good anymore, and you will lose the urine. Therefore, for women, primarily losing urine, meaning incontinence, and for men, usually not emptying the bladder completely. For both women and men, you very frequently have the urgency problematic, that you have to go to toilet very often, since you feel the bladder is filled up by day and by night, and you have to find out what the reason for that.
Okay. So how do you differentiate between when to use which surgical technique?
For the for incontinence, or
yeah.
Okay. For incontinence, we have to decide what's the severity of the incontinence. For women, for example, you will start with exercising the pelvic floor to improve the continence, and there are some herbal extracts or medications to improve that as the second step. And for the surgical procedure, we will look according to the part of the prolapse. If the urethra is coming down in the pelvic floor, or the bladder, or the vagina, then we have to differentiate for the procedure. There are different procedures, and we have to select very precisely to put in the TVT sling, or to make an open surgery. That depends on the exact evaluation of the reason.
Okay. So how do you differentiate what happens after removing the prostate cancer? Mm-hmm. How different is life for a person after the cancer is removed?
After removal of the prostate, when it's done correctly, the degree of incontinence is usually very low, or it decreases with the couple of months very dramatically, so that you have only small pads after half a year or so. Therefore, the incontinence drops down, and you have to exercise your pelvic floor, the muscles, and you can have these pads to manage that. The other thing is for men the potency that is diminished usually also for a time, and thereafter you can use Viagra or these medications up to vacuum devices or injection therapy to gain again a good erection.
Okay. So how does one know that they have been going under the cancer procedure if they have figured out that they are in the initial stages of the tumor being malignant?
Yeah.
Is the process very difficult for the patient in terms of recovering, in terms of going through the procedure?
Yes, that again depends on the stage in which you find out you detect the cancer. If you have very early stages, then you probably do not have to operate, and you, on the other side, you can apply, for example, the so-called hyphotherapy. That means that the tumor is treated within the prostate. You leave the prostate in the body and treat the cancer within that. You treat only the region where the tumor is positioned, and then you do not have any risk for incontinence or for impotency using that. And the other part of your question, after surgery?
Yeah, just recovery and how to deal with it.
Yes, the recovery time is needs around 3 to 6 months to have a good continence, but at the beginning you stay in the hospital for around 1 week, and thereafter you have a recovering time up to doing nearly everything in your life, around 6 weeks to 12 weeks around that.
All right. Mohammed O. Safadi wants to know, what is the healthy practice of drinking water every day?
Pardon?
Drinking water every day. Healthy practice of drinking water every day.
Yes, that's primarily the amount of water to drink, and that's depending on your on the special patient, or and you should drink so much that the urine is light yellow, and you should not drink too much. More than 3 liter or 4 liter, that's definitely too much, and therefore this amount you should judge according to the color of your urine.
Okay, Mr. Maroon Farah wants to know is how can we fight prostate cancer? Is it spice related? Like the intake of spices?
No.
Will that make a difference?
Prostate cancer is not related to food and spices.
All right. Okay, thank you so much for being with us today, doctor.
Okay, thank you.
Thank you for helping us.